Question 1. A patient receiving an IV vesicant chemotherapy agent reports sudden burning at the IV site, and you note swelling and blanching. What is your best immediate action? A. Stop the infusion, leave the IV catheter in place, aspirate drug from the catheter, and notify the provider. B. Remove the IV catheter immediately and apply a warm compress to the site. C. Continue the infusion at a slower rate and reassess in 15 minutes. D. Elevate the limb and apply a cold compress without changing the infusion. Answer. A. Stop the infusion, leave the IV catheter in place, aspirate drug from the catheter, and notify the provider. Rationale. This is likely extravasation of a vesicant. Stop infusion to prevent further tissue injury, but keep the catheter to aspirate residual drug and permit antidote administration. Notifying the provider allows ordering specific antidotes, for example, hyaluronidase or phentolamine, and wound care. B is incorrect because removing the catheter prevents aspiration and accurate assessment. Warm versus cold depends on the agent. C is incorrect. Continuing risks severe necrosis. D is incorrect because compresses without stopping or aspirating and notifying delay definitive treatment. Question 2. 12 hours after starting induction chemotherapy for acute leukemia, a patient becomes hypotensive, confused, and labs show potassium ion 6.2 milliequivalent per liter, phosphate elevated, calcium low, and uric acid elevated. What should you prioritize? A. Administer IV calcium gluconate immediately and document. B. Initiate aggressive IV fluids, obtain labs or ECG, and notify provider for tumor lysis protocol. C. Restrict oral fluids and place strict intake or output orders only. D. Start empiric broad-spectrum antibiotics for sepsis. Answer. B. Initiate aggressive IV fluids, obtain labs or ECG, and notify provider for tumor lysis protocol. Rationale. This presentation suggests tumor lysis syndrome TLS. First priority is aggressive IV hydration to enhance renal perfusion and excretion of potassium or uric acid. Obtain ECG and labs, and activate TLS management, for example, resburicase, insulin, or glucose for hyperkalemia. A is incomplete and potentially harmful. Calcium reserved for life-threatening hyperkalemia with ECG changes because calcium can precipitate with high phosphate. C is wrong. Restriction worsens TLS. D is incorrect. While sepsis is possible, labs point to metabolic TLS requiring urgent metabolic management. Question 3. A chemotherapy patient has ANC 400 per microliter and records a single oral temperature of 38.3 degrees Celsius, 101 degrees Fahrenheit. What is the nurse's best next step? A. Administer antipyretic and observe for 24 hours. B. Draw blood cultures, start broad-spectrum IV antibiotics per febrile neutropenia protocol, and notify provider. C. Place patient in protective isolation and delay antibiotics until cultures return. D. Send patient home with oral antibiotics if symptoms are mild. Answer. B. Draw blood cultures, start broad-spectrum IV antibiotics per febrile neutropenia protocol, and notify provider. Rationale. Febrile neutropenia, ANC, less than 500 and fever greater than or equal to 38.0 degrees Celsius, is an oncologic emergency. Obtain cultures and begin empiric IV antibiotics promptly. Delays increase mortality. A is unsafe, antipyretics mask severity. C. Delays life-saving treatment. D is unsafe, oral therapy and discharge are inappropriate for febrile neutropenia. Question 4. A patient with a central venous port is scheduled for contrast CT using a power injector. The port documentation lists not power injectable. What should you do? A. Use the port anyway, but reduce injection rate to avoid damage. B. Arrange peripheral IV access or request a power injectable port placement and notify the radiology team. C. Flush port with extra heparin and proceed as ordered. D. Cancel the CT and tell the patient to return another day without notifying the provider. Answer. B. Arrange peripheral IV access or request a power injectable port placement and notify the radiology team. Rationale: non-power ports cannot safely tolerate high pressures from power injectors. Using them risks catheter rupture, extravasation, or device failure. Secure peripheral access or a power port is required and radiology must be informed. A is risky and not allowed. Altering rates doesn't eliminate pressure risk. C is irrelevant. Flushing doesn't change port construction. D is inappropriate. Must coordinate with provider or radiology, not unilaterally cancel. Question 5. A patient on long-term opioids for cancer pain has new confusion, pinpoint pupils, and decreased respiratory rate after receiving their scheduled dose. What is the most appropriate immediate nursing action? A. Hold next dose and recheck in 2 hours. B. Administer naloxone per protocol and call for emergency help. C. Document sedation as expected and continue monitoring. D. Encourage deep breathing and provide oxygen by nasal cannula only. Answer: B. Administer naloxone per protocol and call for emergency help. Rationale: signs indicate opioid overdose with respiratory depression. Administer naloxone immediately per facility protocol and call for help. Delaying reversal can be fatal. A is insufficient and delays life-saving reversal. C is unsafe. This is not expected sedation. D. Oxygen and breathing support may complement naloxone, but are not definitive. Naloxone is required. Question 6. A patient receiving an oral chemotherapy agent reports vomiting and missed 2 doses. Home instruction emphasize taking drug on an empty stomach. Which action is most appropriate? A. Instruct the patient to take the 2 missed doses now with food. B. Contact the provider for guidance. Hold doses until provider gives specific instruction. C. Tell the patient to double the next dose to make up for missed doses. D. Document non-compliance and continue scheduled administration. Answer: B. Contact the provider for guidance. Hold doses until provider gives specific instruction. Rationale: oral chemo dosing and missed dose management vary by agent and toxicity. Nurse should contact provider or pharmacist for specific instructions to avoid overdosing or increased toxicity. A and C are unsafe. Taking missed doses inappropriately or doubling can increase toxicity. D ignores patient safety and fails to address potential treatment efficacy. Question 7. A patient on external beam radiation complains of severe new onset dyspnea and facial swelling after radiotherapy to the chest. Which action should the nurse take first? A. Administer prescribed PRN, anxiolytic, and reassess. B. Elevate head of bed, apply oxygen, and notify provider for suspected superior vena cava (SVC) syndrome. C. Instruct patient to perform pursed lip breathing and schedule CT later. D. Offer cold packs to reduce facial swelling and document. Answer: B. Elevate head of bed, apply oxygen, and notify provider for suspected superior vena cava (SVC) syndrome. Rationale: rapid facial or upper extremity swelling and dyspnea after chest tumor or radiation suggests SVC syndrome. Immediate actions are airway support O2, positioning and urgent provider notification for emergent interventions, stent, radiation, steroids. A delays care. C delays diagnosis. CT may be needed but not later without urgent stabilization. D is ineffective and delays necessary urgent treatment. Question 8. A patient with neutropenia needs a dressing change on a central line exit site. Which is the most important infection prevention step? A. Don clean gloves and proceed. B. Perform hand hygiene, don sterile gloves and mask, and use aseptic technique. C. Use only alcohol-based hand rub immediately before touching the site. D. Ask the patient to wear a gown and proceed without hand hygiene. Answer: B. Perform hand hygiene, don sterile gloves and mask, and use aseptic technique. Rationale: for central line care, especially in neutropenic patients, strict aseptic technique, hand hygiene plus sterile gloves or mask as per policy, prevents bloodstream infections. A is insufficient. C is incomplete. Alcohol hand rub is part of hand hygiene, but does not replace sterile technique. D is unsafe and violates infection control. Question 9. A chemotherapy patient reports new onset unilateral leg swelling and calf pain after prolonged travel. Vital signs stable. What is your priority action? A. Apply warm compress and ambulate to reduce edema. B. Notify provider and arrange Doppler ultrasound to evaluate for deep vein thrombosis (DVT. C. Start anticoagulation immediately without diagnostic testing. D. Encourage increased oral fluids and observe. Answer. B. Notify provider and arrange Doppler ultrasound to evaluate for deep vein thrombosis (DVT. Rationale. Cancer patients have elevated thrombotic risk. Unilateral swelling and calf pain require prompt diagnostic evaluation for DVT. Timely diagnosis guides anticoagulation. A and D are inappropriate and delay diagnosis. C is risky. Anticoagulation usually requires confirmation and provider order, except in life-threatening situations. Bleeding risk must be weighed in oncology patients. Question 10. A newly placed chest port door-to-needle flush shows blood return that is sluggish with patient reporting increased shoulder pain. Which is the most appropriate initial nursing action? A. Apply moist heat to the chest and continue using the port. B. Stop using the port, assess for mechanical problems, for example, catheter kinking. Verify placement with chest X-ray per protocol, and notify provider. C. Push vigorously on the catheter to restore patency. D. Remove the port immediately at bedside. Answer. B. Stop using the port, assess for mechanical problems, for example, catheter kinking. Verify placement with chest X-ray per protocol, and notify provider. Rationale. Sluggish blood return and pain suggest catheter malposition, thrombosis, or migration. Stop use to prevent complications, assess, and confirm placement or imaging per protocol. A is not corrective. C is unsafe. Forceful flushing risks embolism or catheter damage. D cannot be done at bedside without surgical or IR involvement. Removal requires provider order and sterile procedure. Question 11. A patient with mucositis after high-dose chemo refuses oral care due to pain, increasing risk for infection. Which action best balances comfort and infection prevention? A. Allow the patient to skip mouth care until pain subsides. B. Offer frequent, gentle oral care with prescribed topical anesthetic or rinse and continue neutropenic precautions. C. Use vigorous toothbrush scrubbing to reduce bacterial colonization. D. Start prophylactic systemic antibiotics instead of oral care. Answer. B. Offer frequent, gentle oral care with prescribed topical anesthetic or rinse and continue neutropenic precautions. Rationale. Mucositis raises infection risk. Gentle oral care with topical analgesia maintains mucosal integrity and reduces infection risk. A. Increases risk. C is harmful. Vigorous scrubbing can cause bleeding and new portals for infection. D is inappropriate. Systemic antibiotics are not a substitute for oral hygiene and have risks. Question 12. A patient on irinotecan reports severe diarrhea and dizziness 2 days after infusion. Which immediate nursing action is most appropriate? A. Encourage oral fluids and send home with antidiarrheal PRN. B. Assess vital signs, orthostatic changes, and initiate IV fluids per provider for dehydration. Notify provider. C. Administer laxatives to clear GI tract. D. Document as expected side effect and schedule next dose sooner. Answer. B. Assess vital signs, orthostatic changes, and initiate IV fluids per provider for dehydration. Notify provider. Rationale. Irinotecan can cause severe diarrhea leading to dehydration and hypotension. Assess for hemodynamic instability and provide IV fluids and provider notification for urgent management. A may be inadequate for severe diarrhea. C is contraindicated. Laxatives worsen diarrhea. D is unsafe and nonsensical. Question 13. During chemotherapy preparation, a nurse discovers a 20% higher dose than prescribed has been programmed on the infusion pump, but not yet started. What is the correct immediate action? A. Start the infusion slowly and monitor for adverse effects. B. Do not start. Verify order. Quarantine the prepared dose. Notify pharmacist and provider. and follow medication error protocol. C. Reprogram the pump to the correct dose without documentation. D. Administer half the infusion to approximate correct dose. Answer. B. Do not start. Verify order, quarantine the prepared dose, notify pharmacist and provider, and follow medication error protocol. Rationale. A discovered dosing discrepancy is a potential medication error. Do not start the infusion. Verify orders, hold the medication, notify pharmacy/provider, and follow institutional reporting and safety protocols to prevent patient harm. A, C, and D are unsafe, circumvent checks, and risk overdose or legal or ethical violations. Question 14. A hospitalized oncology patient on oral bisphosphonate has poor renal function, creatinine elevated. Which safety consideration is most important before administering the next dose? A. Proceed with dose because oral bisphosphonates are safe in renal impairment. B. Verify current renal function with a provider and pharmacy before dosing. Hold or adjust dose as indicated. C. Double the dose to compensate for decreased efficacy. D. Stop all cancer medications permanently. Answer. B. Verify current renal function with the provider and pharmacy before dosing. Hold or adjust dose as indicated. Rationale. Many oncology medications require renal dosing adjustments. Bisphosphonates can be contraindicated or require dose modifications in renal impairment. Verify labs and consult provider or pharmacy. A is unsafe. C and D are inappropriate extreme actions without clinical rationale. Question 15. A patient receiving home infusion of a vesicant reports redness and tightness around central line insertion site, but the dressing looks intact. What should the nurse instruct the home health nurse to do first? A. Remove dressing immediately and restart dressing at new site. B. Assess for signs of infection or extravasation. Check for blood return. Stop infusion if any concern, and notify the provider. C. Increase infusion rate to flush the area. D. Apply topical steroid cream and continue infusion. Answer. B. Assess for signs of infection or extravasation. Check for blood return. Stop infusion if any concern, and notify the provider. Rationale. Redness and tightness may signal infection, phlebitis, or catheter complications. Assess, check patency blood return, and stop infusion if problem suspected. Then notify provider. A removes dressing before assessment. C and D are unsafe and may worsen outcomes. Question 16. A patient scheduled for first cycle of methotrexate shows BUN and creatinine rising and urine output dropping. Leucovorin rescue is ordered after chemotherapy. What is the safest nursing action regarding methotrexate administration? A. Administer methotrexate as ordered and then call provider about labs. B. Hold methotrexate, notify provider urgently about renal impairment, and verify timing or dose of leucovorin rescue and hydration needs. C. Reduce methotrexate dose by half and proceed. D. Proceed and increase antiemetic therapy only. Answer. B. Hold methotrexate, notify provider urgently about renal impairment, and verify timing or dose of leucovorin rescue and hydration needs. Rationale. Methotrexate is renally excreted. Renal impairment increases toxicity risk. Hold chemo until provider reassesses and ensures adequate leucovorin rescue and hydration. A risks severe toxicity. C and D are unsafe without provider or pharmacy guidance. Question 17. A hospitalized oncology patient with a platelet count of 22,000 per microliter needs a central line dressing change. Which is the best nursing approach? A. Proceed with dressing change using routine technique immediately. B. Consult provider about platelet transfusion before invasive dressing change and use gentle sterile technique to minimize bleeding. C. Delay dressing change indefinitely to avoid bleeding. D. Use a razor to shave area for better dressing adherence. Answer. B. Consult provider about platelet transfusion before invasive dressing change and use gentle sterile technique to minimize bleeding. Rationale. Severe thrombocytopenia increases bleeding risk. Consult provider for platelet transfusion to safely perform invasive procedures, and use gentle sterile technique. Are risks bleeding? C. Risks infection from prolonged dressing, so inappropriate. D is contraindicated. Razor causes bleeding. Question 18. A patient who will receive handling of cytotoxic waste at home asks how to dispose of used sharps and contaminated dressings. What is the safest answer? A. Put everything in regular household trash once wrapped. B. Use approved sharps containers and follow facility or home health instructions for hazardous waste pickup or return. Avoid flushing dressings down toilet. C. Burn contaminated dressings in the backyard to destroy agents. D. Rinse dressings and discard down sink. Answer. B. Use approved sharps containers and follow facility or home health instructions for hazardous waste pickup or return. Avoid flushing dressings down toilet. Rationale. Cytotoxic waste must be disposed via approved containers and institutional or home health hazardous waste protocols to protect household and community. A, C, and D are unsafe and illegal in many jurisdictions. Question 19. A nurse witnesses a coworker fail to verify 2 patient identifiers before administering an IV chemo bolus, and then documents the administration. What is the appropriate nursing response? A. Confront coworker aggressively and remove them from duty. B. Follow facility incident reporting and medication error policies. Assess patient for harm, notify provider, document factual findings, and complete a report. C. Ignore it because the patient appears fine. D. Take over and finish documentation to protect the coworker. Answer. B. Follow facility incident reporting and medication error policies. Assess patient for harm, notify provider, document factual findings, and complete a report. Rationale. Failure to verify identifiers is a medication safety breach. Protect patient safety first, assess, notify, then follow reporting protocols for learning or prevention. A is unprofessional and may escalate. C and D conceal errors and endanger patients and violate policy or ethics. Question 20. A patient with advanced cancer requests assisted suicide information. Institutional policy prohibits it. What is the nurse's best approach? A. Refuse to discuss and tell the patient it's illegal everywhere. B. Acknowledge patient distress, assess for symptoms, pain, depression, involve palliative care or ethics, provide support, and discuss legally available options for symptom management. C. Provide detailed instructions for assisted suicide to respect autonomy. D. Ignore the request and change the subject. Answer. B. Acknowledge patient distress, assess for symptoms, pain, depression, involve palliative care or ethics, provide support and discuss legally available options for symptom management. Rationale. Even when legal/ethical options are limited, nurses must respond compassionately, assess unmet needs, involve palliative care and mental health, and explore symptom control and psychosocial supports. A is dismissive and inaccurate. C is illegal or unethical in restricted settings. D ignores suffering. Question 21. A neutropenic client receiving induction chemotherapy reports a new temperature of 38.3 degrees Celsius, 101 degrees Fahrenheit, and rigors. What is the nurse's priority action? A. Administer acetaminophen as prescribed. B. Obtain blood cultures immediately. C. Notify housekeeping to deep clean the room. D. Increase oral fluid intake. Answer. B. Obtain blood cultures immediately. Rationale. Neutropenic fever equals oncologic emergency. Cultures must be obtained before antibiotics. Acetaminophen, A. Masks fever. Housekeeping, C. Irrelevant. Fluids, D. Supportive only. Question 22. A client with tumor lysis syndrome shows a potassium level of 6.8 milliequivalent per liter. What should the nurse prepare to administer first? A. IV insulin with dextrose. B. 0.9% normal saline bolus. C. Oral sodium polystyrene. D. Furosemide IV. Answer. A. IV insulin with dextrose. Rationale. Hyperkalemia requires immediate potassium shift, insulin plus dextrose. Fluids, B. Supportive. Kxalate, C. Works slowly. Furosemide D. Not immediate. Question 23. A client receiving cisplatin suddenly reports tinnitus and decreased hearing. What is the nurse's priority? A. Document the finding. B. Stop the infusion and notify provider. C. Provide eardrops. D. Encourage hydration. Answer. B. Stop the infusion and notify provider. Rationale. Ototoxicity requires immediate cessation of cisplatin. Documentation. A. Insufficient. Eardrops. C. Ineffective. Hydration. D. Prevents nephrotoxicity, not ototoxicity. Question 24. A client with metastatic breast cancer on IV opioids becomes difficult to arouse with RR6 per minute. What is the first action? A. Administer naloxone. B. Reduce next opioid dose. C. Apply oxygen by nasal cannula. D. Call a rapid response. Answer. A. Administer naloxone. Rationale. Naloxone immediately reverses opioid-induced respiratory depression. Reducing future dose. B. Won't fix current crisis. Oxygen. C. Insufficient alone. Rapid response. D. Follows naloxone. Question 25. A client receiving radiation to the neck has new difficulty swallowing and thick secretions. What should the nurse do first? A. Hold all oral medications. B. Assess for airway patency. C. Provide oral suctioning. D. Offer thickened fluids. Answer. B. Assess for airway patency. Rationale. Neck radiation risks airway obstruction. Airway assessment first. Holding meds. A. Secondary. Suctioning. C. Done after ensuring airway. Thickened fluids. D. Unsafe during airway compromise. Question 26. A client receiving high-dose methotrexate has a level above therapeutic range. What is the priority intervention? A. Increase oral folic acid. B. Administer leucovorin rescue. C. Increase protein intake. D. Administer antiemetic. Answer. B. Administer leucovorin rescue. Rationale. Leucovorin reverses methotrexate toxicity. Folic acid. A. Insufficient. Diet. C. Irrelevant. Antiemetic. D. Only treat symptoms. Question 27. A client on immunotherapy, checkpoint inhibitor, develops sudden severe diarrhea and abdominal pain. What does the nurse suspect? A. Infectious colitis. B. Immune-mediated colitis. C. Chemotherapy-induced nausea. D. Food poisoning. Answer. B. Immune-mediated colitis. Rationale. Immune checkpoint inhibitors commonly cause autoimmune colitis. Infection. A. Must be ruled out, but triad fits immune toxicity. Question 28. A client receiving vesicant chemotherapy via peripheral IV reports burning at the site. What is the first action? A. Slow the infusion. B. Apply warm compress. C. Stop the infusion immediately. D. Flush the line with saline. Answer. C. Stop the infusion immediately. Rationale. Burning equals extravasation. Stopping infusion prevents tissue necrosis. Slowing. A. Worsens. Warm compress. B. Can worsen some extravasations. Flushing. D. Spreads vesicant. Question 29. A client with SVC syndrome has increasing facial edema and dyspnea. What is the priority action? A. Elevate HOB. B. Administer diuretics. C. Restrict fluids. D. Apply cool compresses. Answer. A. Elevate HOB. Rationale. Elevating HOB improves venous return. Diuretics. B. Ineffective in obstruction. Fluids. C. Irrelevant. Compresses. D. Do nothing. Question 30. A client with leukemia receiving chemo has platelets of 8,000 per cubic millimeter and reports a new headache. What action is priority? A. Give acetaminophen. B. Notify provider immediately. C. Dim lights for comfort. D. Offer oral hydration. Answer. B. Notify provider immediately. Rationale. Headache plus severe thrombocytopenia equals possible intracranial hemorrhage. Immediate provider notification required. Question 31. A client receiving doxorubicin shows new shortness of breath and S3 heart sound. What should the nurse prepare for? A. Administer diuretics. B. Obtain an echocardiogram. C. Start oxygen therapy. D. Increase fluids. Answer. B. Obtain an echocardiogram. Rationale. Doxorubicin cardiomyopathy. Echo confirms EF. Diuretics, A, are supportive, not diagnostic. Fluids, D, harmful. Question 32. A client on chemotherapy develops white patches in the mouth and pain when swallowing. What is the best intervention? A. Brush teeth vigorously. B. Obtain antifungal medication. C. Increase acidic fluids. D. Provide chlorhexidine mouth rinse. Answer. B. Obtain antifungal medication. Rationale. Oral thrush requires antifungals. Brushing vigorously. A. Worsens mucositis. Acidic fluids. C. Irritate mucosa. Chlorhexidine. D. Can worsen mucositis. Question 33. A newly diagnosed lymphoma patient expresses a desire to stop all treatment, stating they don't trust chemotherapy. What is the nurse's first action? A. Notify the oncologist immediately. B. Explore the client's feelings and concerns. C. Provide printed education materials. D. Encourage family involvement. Answer. B. Explore the client's feelings and concerns. Rationale. Therapeutic communication is priority. Provider notification, A, comes later. Question 34. A client receiving monoclonal antibodies develops itching, wheezing, and hypotension. What is the priority action? A. Stop the infusion. B. Apply cool compress. C. Monitor vitals every 30 minutes. D. Restart infusion at slow rate. Answer. A. Stop the infusion. Rationale. Symptoms indicate anaphylaxis. Stop immediately. Restarting D is dangerous. Monitoring C delays action. Question 35. A client post-bone marrow transplant reports a rash on palms or soles, jaundice, and watery diarrhea. What is the nurse suspect? A. Infection. B. Graft versus host disease. C. Sepsis. D. Medication allergy. Answer. B. Graft versus host disease. Rationale. Rash plus liver dysfunction plus diarrhea equals GVHD. Infection. A. Not typically presents with all three. Question 36. A client with pancytopenia reports shortness of breath and has hemoglobin 5.8 gram per deciliter. What should the nurse do first? A. Prepare for blood transfusion. B. Increase oral iron intake. C. Encourage deep breathing. D. Administer erythropoietin. Answer. A. Prepare for blood transfusion. Rationale. Severe anemia requires immediate transfusion. Iron B and erythropoietin D take days. Question 37. A client on chemotherapy has ANC 200 in family, wants to bring fresh fruit and flowers. What should the nurse do? A. Allow both with hand hygiene. B. Allow fruit but not flowers. C. Prohibit both immediately. D. Allow flowers but not fruit. Answer. C. Prohibit both immediately. Rationale. ANC less than 500 equals severe neutropenia, no fresh produce or flowers. Question 38. A client receiving high-dose steroids for brain metastases reports blood glucose of 410 milligrams per deciliter. What is the priority? A. Administer sliding scale insulin. B. Restrict carbohydrates. C. Increase physical activity. D. Recheck glucose in 2 hours. Answer. A. Administer sliding scale insulin. Rationale. Severe steroid-induced hyperglycemia requires immediate insulin. Diet or exercise changes, B, C, are long-term. Question 39. A client with suspected spinal cord compression reports new urinary retention and leg weakness. What is the first action? A. Obtain a bladder scan. B. Prepare for MRI. C. Administer high-dose corticosteroids. D. Apply warm compresses. Answer. C. Administer high-dose corticosteroids. Rationale. Steroids reduce edema and prevent paralysis. MRI B follows. Bladder scan A. Delays emergency management. Question 40. A client with advanced cancer expresses hopelessness and states, "I don't want to live anymore." What is the nurse's best response? A. Tell them to stay positive. B. Ask directly if they are thinking of self-harm. C. Encourage family involvement. D. Offer to call chaplain. Answer: B. Ask directly if they are thinking of self-harm. Rationale: direct suicide assessment is therapeutic and required. Stay positive. A. Dismisses concerns. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.